It's one of the most common patient complaints in medicine today. Back pain. It affects more than 76 million Americans every year. Experts estimate that 8 out of 10 people will experience it during their lives. For some, back pain is a short-term episode that lasts from just a few days to several weeks. But for many other sufferers, back pain lingers, making it difficult to find comfort or to do simple activities.
I've had back pain for about 20 years, and it restricted my lifestyle of riding bikes, running the sweeper, bending, stooping, and I had the TruFUSE procedure done, and it has increased my quality of life tremendously.
Oh, I've had back pain most of my adult life. The impact was basically a lot of pain. It got to the point that I couldn't play tennis, I couldn't play golf, and just shuffled around from room to room with a lot of pain.
Minsurg Corporation's TruFUSE Facet fusion is revolutionizing the way back pain is treated.
Back pain sufferers try a large variety of techniques to reduce the pain. Some are home remedies, ointments, creams. Others are chiropractic, manipulation, physical therapy, acupuncture, stretching techniques. And when it becomes intolerable, then they move on to surgical, both injection and surgical techniques.
Traditional fusion is where rods and screws are placed in the back to act like an internal brace to keep the back from moving. Some of the problems associated with it are increased pain, long surgery times, hardware failure, persistent symptoms. And so this is something that really is a last resort for patients.
A viable alternative, TruFUSE eliminates the cause of pain without the use of drugs, screws, rods, or major surgery. The procedure is performed in an open, minimally invasive fashion.
The procedure is performed one of two ways, either open, where classic surgery, they're open the skin and perform it that way, or minimally invasive with a very small incision. As you go down to the facet joint, we cut the tissue or dilate the tissue down to the joint, open the joint and separate it, then the drill bit cuts the bone and packs the patient's own bone down into the joint, and then we wedge in an allograft dowel that holds the joint still and allows for a natural healing through a bony fusion.
Developed by Dr. David Peterson as a potential cure for his own back problems, the procedure is becoming an optimal solution for back pain sufferers across the nation.
TruFUSE is used as an adjunct to other surgery. For instance, if you're having a front and back fusion of the spine, it's also used after a decompression or removing the disc and fusing the joint. It can be used in combination or standalone.
TruFUSE Facet fusion has been shown to be successful in relieving back pain.
With traditional fusion, the idea is to stop the motion in the joints with the hardware. With something called facet fusion, a little piece of bone is put in the joints, and by putting the bone in the joints, it stops the motion without putting in a lot of hardware into the patient's back, much less surgical time, much quicker recovery.
Patients who undergo the procedure experience a more complete recovery, greater post-surgery flexibility, and a more active lifestyle.
The benefits have just been wonderful. The hospital stay was short. I was out of pain almost immediately, well on my way to recovery, and I have no pain.
To date, more than 5,900 levels of TruFUSE have been implanted in the U.S.
The biggest impact is that the patient has chronic pain pre-op, they have the surgery, and within a very short period of time, they're back functioning, able to do things they haven't been able to do in a very long time. They have had a relatively small operation in order to accomplish that. I myself had the surgery about 5 weeks ago, and I can tell you there are so many things that I'm able to do now that I could not do before the surgery. And then you'll stay overnight, and then the next morning, depending on how you're doing,